3 tips that you can integrate into your routine postpartum from the day you deliver is what we're going to review today. Now, these are awesome if you're 1 day postpartum to 2 weeks postpartum, really even safe 3 years postpartum, and great exercises to just do on the daily to help keep your core strong. But as we recover initially postpartum, we want to help our core recoil nice and tight and protect our organs from falling out of our bodies and just help everything come back together, especially when you feel like a bag of bones after you've been growing your baby for 9 months and all of a sudden the baby's outside of your body and you want your tissue to come back together. You want your uterus to shrink back down. These exercises are going to be safe for you to do from day one, whether you had a C-section or a vaginal delivery. I'm Dr. Allison. I own Body Motion Physical Therapy. We're a group of pelvic floor physical therapists specialized in helping people through fertility, pregnancy, postpartum, all through menopause. And we help women live their best lives so they can avoid things like joint replacements and joint injections or bladder surgeries later on in life. How you recover postpartum is epically important in helping prevent the soliloquy of aches, pains, and surgeries as we get into our 40s, 50s, and 60s and beyond. So I'm so glad you're here, and I'm so glad that you're invested in helping your core heal postpartum so it can be super effective as you recover and age. The first exercise we are going to be doing together is going to be called diaphragmatic breathing. This is a type of breathing that you use to help bring your diaphragm that sits underneath your rib cage down into your belly. Now, we don't want to push our diaphragm down. We just want to help it take up more space. Now that your baby's not in the belly anymore, we need the diaphragm to descend down into the belly and regain its range of motion that it lost during the 9 to 10 months of pregnancy. So what we're going to do is we're going to put one hand on our belly, one hand on our chest. You're going to take a nice, let's do it this way, a nice deep breath into the hand on the belly. Inhale and opening, exhale, let it go. We're trying not to let the hand on the chest move. Inhale and open. Exhale and let it go. Again, you're not pushing, you're not like straining, pushing your organs down. You're just simply letting the air go into the hand on the belly, filling up the space, retraining that diaphragm to drop all the way down into the belly as low as it can go. And now that we've done that type of breathing, we're going to take it a step further and we're going to help open up the pelvic floor and get some range of motion inside the pelvic floor. If you imagine that your vagina is a rosebud, we want on the inhale to blossom all the petals of the rosebud so we can see the entire flower. And that's what your vagina should be doing. It should be opening when you inhale. So now we're going to inhale into belly. Air fills, exhale. Air leaves our body. Inhale again. Vagina's opening. Exhale. We get some natural recoil. Now, if you have a lot of stitches in your vagina or in your perineal area, then you can just focus on doing the belly breathing to start, and you can add in the pelvic floor piece as that feels okay in your body. And again, if you had a C-section, this is still safe for your body. And you can check out our C-section videos as well to help you heal specifically from the C-section. Now we're going to take this a step further and we're going to do more of a lateral costal breathing. And this is to help the diaphragm expand in a 360-degree circle. So we're going to put our hands on our chest and our rib cage. And we're going to inhale into our hands, our lateral ribs. Inhale and open. Exhale and let it go. Inhale and open. Inhaling through the nose, exhaling through the mouth. In a standing position together, we'll keep our hands on our rib cage, continue with the lateral costal breathing. We're going to inhale into our rib cage. Exhale. Let it go. Inhaling through our nose. And as you exhale, I want you to use a shh SH sound, helping knit the rib cage back together, activating our entirety of our core and anterior core muscles here. Inhale and open. Exhale and let it go. Okay, you have just done 2 amazing exercises. You've done a diaphragmatic breath, and now you've done a lateral costal breath. Both of these is going to help your diaphragm retrain, which is the very top of your core. It's a super important core muscle. It's going to retrain your diaphragm to start working for you again. You're going to improve your breath capacity, your cardiovascular fitness just from doing this type of breathing, and you're going to improve your core function. Now we're going to take it a step further and we're going to add in an isometric transverse abdominal contraction. You can do this laying down, sitting up, or breastfeeding your baby or feeding your baby a bottle. It doesn't matter what position you are. You should start to actually do this strengthening exercise, this TA activation exercise in any position, because the reality is this muscle is already working during your postpartum experience. So now we are working our transverse abdominis muscle. This is the lower abdominal muscle that is from this hip bone to this hip bone. What I'm going to have you do is you're going to keep your hands right inside the hip bones. Then you're going to inhale into your belly like we already did in the previous exercise, doing a diaphragmatic breath. As you exhale, you're going to shh again, but this time you're imagining your pubic bone pulling up towards your belly button on the exhale, and then let it go. Now, you're not rocking your spine forward and backwards. If this feels better with your knees bent, you can do it with your knees bent. You're not pushing your back flat down. We're not ready for that yet. We don't want to push our back flat down, because if we push our back flat down, most of the time what we're doing is we're pushing our organs down and out. So we want to keep our spine neutral. So you can be with your knees bent or your knees straight, but we want to make sure that we are not pushing our back or arching our back. We're simply just activating this muscle. Deep breath in, exhale, and let it go. Tightening between these 2 hip bones. Imagining if you had a belt or you're trying to fit into your jeans before you were even pregnant, you're pulling up and in. So you're not pushing out, you're not activating your obliques really hard. This is just your transverse abdominis contraction. So you're inhaling, exhale with a shh, and you'll start to get some feeling there. Here is a top-down view. We're here, hands are inside the hip bones. You're gonna inhale. On your exhale, as you you're just activating that transverse abdominis. The belly button goes up just ever so slightly, and you're going to exhale and let it go. We are not kegling or squeezing our pelvic floors right now. We are just activating this transverse abdominis. Here's what it looks like again, completely at rest, without the breath. If I just activate, that is me activating my TA. There's not a lot happening. So you're not pressing your whole abdominal wall down or your whole spine down, and you're not arching, and you're not bracing for a punch. You are simply just right here, right inside your hip bones, activating that muscle. You've had a C-section. This is safe to start doing right away. We want to start turning on those muscles. You might not have as good connection. So put your hands inside those hip bones, obviously not right on the scar on the first day or 2, but right around there. And you're going to just start to activate that TA, activate the transverse abdominis. Here we are in the standing position. And here's what activating the transverse abdominis looks like in standing from the front. Hands are right inside those hip bones. And I'm just going to gently activating the TA, knitting it together, and then let it go. TA, let it go. Here's what it looks like from the side. I'm here. There's the, under here is where I'm firming, just gently, ever so slightly. So you can see my neutral spine position. We're going to TA. It's a very small movement. Go into a relaxed position and So you can do the diaphragmatic breathing, the lateral costal breathing, or the TA activations in any position that you choose. But these are absolutely necessary exercises to help start stimulating your core. It's never too early and it's never too late to start doing these exercises. In fact, I'm 3 years postpartum and I still do these exercises on a daily basis to get good connection to my lower abdominals, because then they start to fire in all the exercises that you do, helping enhance your core activation. I'm Dr. Allison Felt. Thank you so much for being with us today. If you are interested in restoring your body after kids, check out my book, Restore Your Body After Kids: The Secret to Avoid Peeing Your Pants and Achy Joints as You Age, or come to our clinic in Edmonds, Washington for an intensive rehab program where you come for 3 to 4 days and spend all the time healing your scar tissue from birth, healing your muscles, and improving your core recoil after you've had babies. I cannot wait to help you. Please like and subscribe to this video and share with all your friends who have just had kids. Take care.